Okay.
Yeah, today my topic is health-related age-appropriate quality of life assessment, HRQOL. The health-related quality life assurance is a quality of life is a health is a related of quality of life refers to the psychological, social and physical functioning specific to the treatment of the patient's medical illness. In addition to understanding a patient's clinical data, it is important to understand and monitor HRQOL. Patients report quality of life as being a primary concern when making a medical decisions.
Sandeep, do you have to change the slide?
Actually, I have completely increased the size, but
I see only the first slide.
Can you see now?
No, we can see, Sandeep, but they're not moving on. You're still on the first slide.
Or is it? Just a minute.
Yes, okay.
Can you see, sir, now?
Yes, yes.
Okay, so when we are speaking about HRQOL, just I want to give a World Health Organization health definition. Health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. So, if you want to tell like health, the person is healthy means he has to be physically, mentally, and socially. He has to be fit for for everything. So again, I have shared here some slide about the growth and development. A normal person, how the growth and development has to be there. So the growth is a physical changes in height and weight and appearance. The person's physical change of the height and weight and appearance is what we see as a growth. The development is a change of functional ability, which is a cognitive, motor, and psychological aspects. The stages of growth and development is like the stage 1 is the embryo, implantation to 8 weeks will be there. The fetus 9 weeks to till birth, and newborn what we'll call birth to 28 days, that's a 1 month, and infant what we'll call like 1 month to 1 year. Toddler age is 1 to 3 years, preschool 3 to 5 years, and school going 6 to 12 years, and adolescent what we call more than 13 years to 18 years. So here some states like I have mentioned normal growth of the average growth of the as per age wise for the males and females. So as a weight and age wise I mentioned. Usually the transplant ages what we have seen like more than 3 years only generally we are doing the transplant. So something like 6 years old patient, the weight has to be approximately 20 kg and height has to be 116 centimeter. In a female, slightly for 6 years, it will be 19.5 kg and 114 centimeter height will be there. So here like till 12 years, as we are doing the more pediatric transplant, so 0 to 12 years I have mentioned here. And this all the organs for growth and development when we say called as, so this all the organs are very important, which is involved. So generally when we do the transplant, what we have seen that usually the transplant related medications such as busulfan and cyclophosphamide, sometimes it will affect to these organs. And generally in thalassemia cases, what we have seen, if somebody like thalassemia was not managed very well, sometimes these organs will be affected. So pituitary gland is the main thing which will produce the growth hormone, which will help the growth of the person. And thyroid hormone, which will control the metabolism rates. And parathyroid hormones, which will control the calcium balance in our body. And adrenaline is the very important drug for emergency, adrenal gland. And pancreas, which will produce the insulin for us, which will control the glucose level in our body. And testosterone in the male and ovaries in the females, which is a sex hormones with development of the reproductive organs. So generally the medication which we are using busulfan, it will affect the male reproductive organ, female reproductive organ, and cyclophosphamide what we are using, it will affect to male's reproductive organ. So here are some of the questions generally what we'll ask during HRQOL. So there is a age wise is there 2 to 7 years. Generally, we will take feedback from the patient attenders. And 8 to 12 years, like when patient himself gives the feedback. So generally the questions will be like physical functioning of the patient, emotional function, social functioning, and the school functioning. So these are the questionnaires will be there. And 12 to 8 years, generally it will be again like about patient health and activity, about the feeling, and how you get along with the others, and about the school. So these are the questions will be questionnaires will be there. So generally, as I told you, 2 to 7 out of the 2 to 4, the parameters is that generally we will ask a question with the parents. So how patient is walking, how patient is running, how patients are participating actively, playing in exercise, lifting something heavy items, bathing, helping to pick up his or toys, having hurt or aches, and low energy levels. So these are the things that then we will ask with the physical function of the patient. And sometimes also we'll ask the emotional functions of the patients, where feeling about how afraid and scared, and sad and blue, and anger, sleep, trouble in sleep, worrying. So these are things we'll see in the emotional thing. And social thing, how patients are mingling with others, playing with others, and how patients will cope up with the mingling the team and school friends. There we'll see. And also school functioning, we'll see doing some school activities with the school mates, and how patients will attend a daycares, and how they're involved. So these are things we'll see in this parameter of age. So there are almost always, often, sometime, almost never, and never. So this parameter, when we ask with the patient relatives, generally in our setups, the OPD nurse who is assigned for the annual follow-ups, the nurse will ask all the questions with the patient attender. She will mark this, when the patient comes for yearly follow-up, so they'll follow up here. Similarly, 5 to 7 years also, the similar questions are there. So where here also parents will give report for us. And 8 to 12 years, slightly the question has changed as about health and activity of the patient. So it's hard to meet the walk, and sometimes the patient will complain to walk, or and sometimes like running, there will be difficulty will be there. Sometimes sports activity difficulty will be there, and sometimes lifting the heaviness will be the difficulty will be there. So sometimes the patient will feel that they have some pain, and they may feel something, they have they're not feeling good energy to do regular activities, and feeling something they will feel afraid, and so similar like previous sleep disturbance, such type of feelings they will feel. So how I get along with the other things? So again, the questions will be there, similar how they will mingling with other friends or group, same age group. And schooling also, sometimes they forget the things. So remembrance will be having a missing school because of they may feel not feeling well. So these are the questions will come in the 8 to 12 years of years. The key points of this thing is like assessing HCT survivor quality of life is essential in order to know the impact that HCT is morbidity, its treatment, and the related intervention have on survivor well-being. Hence, efforts should be made in order to include quality of life assessment in routine clinical practice, engaging clinicians in using of quality of life assessment, potentially by means of electronic administration, as well as broadening the interpretation of their scores into the clinical field, might facilitate the incorporation. Further efforts should elucidate to what extent quality of life result are incorporate into management decision, treatment recommendation, and patient education. Additional efforts should also be made to include quality of life outcome in clinical trials. The incorporation of quality of life assessment into clinical and research practices has potential as improve the HCT. So also the normalized HRQL in the single most important parameter to follow after the BMTU to say whether transplant has been really successful in diseases like thalassemia, which are not immediately life threatening. So the quality of life is very important. Like because when we do the thalassemia transplant, everything is not very emergency. So when we do transplants, everything, it should not affect the quality of the life of the patient. So once we do transplant, is everything automatically they have to be normalized. In condition of leukemia, such of the conditions, slightly if you compromise of the quality of life, it's okay. But thalassemia transplants, everything is not very important, very like very urgent, immediate or emergency something. When it comes for leukemia or aplastic anemia, Fanconi, sometimes it will be very emergency. Immediately we may need to take, and sometimes we may need to compromise some of the quality of the life. And sometimes, like as I mentioned you about the few endocrine organs, still we don't know very clearly about the reproductive hormones, like reproductive system, how we can really prevent. Because some of the studies what we did, like we reduced the busulfan dose and we saw, again we reduced the cyclophosphamide dose and we saw, but slightly our outcome was affected. But after we're going back to full dose of busulfan, full dose of cyclophosphamide, we are seeing some good results. But still we don't have very clear data about how much it has affected for their reproductive system. So thank you, everyone.
Thank you, Sandeep. That was very good. Yeah, I think what you said about healthy and quality of life, absolutely, especially in thalassemia, our real aim at the end is to normalize healthy and quality of life. And that takes into account chronic GVHD, et cetera, et cetera. As you said, for leukemias, since you're saving the life of a child, of course, you want the child to have normal healthy and quality of life, but it's more acceptable to have it compromised compared to thalassemia. And the issue of infertility, right? We don't really know well how infertility in the long run, because of course we're doing transplants in children that may be 5, 7, 10 years of age, and